Lagi na lang dito yung papeles ko. Tangkota na ako yung poste ko.
Mister, give me until this day. Ano na? You're always late on your papers. Napag-usapan na natin to, di ba? O ano yan, hindi na naman tapos.
Boss, ginagawa ko naman po kasi lahat eh. Tsaka boss, tawag nito, nagsisipag naman po ako. Please give me until this day po, boss, para makakampish lahat ng
Oh,
batas.
I will give you until this day. Alam mo, kotang-kota ka na. Sa susunod na, puro ka excuses, sa susunod na gagawin man, you are fired, you know. You will be fired.
Boss ko man. Pucha, kahit kalabaw na nga ako dito eh. Tapos, wala pa rin ako natatapos. Malabo na nga yung paningin. Wala laman. Kalalagay ko lang dito, ba't wala na naman laman? Ay, kuha nga muna ang tubig. Nahihilo na ako.
Okay, ako na. Oh, Mr. gave me until this day. It's the end of the day already. How are we doing regarding the project?
Boss, galing po kasi akong clinic kanina eh. Pinagpahinga po ako ng nurse na hihilo na po kasi ako, tsaka nanginginig na po yung katawan.
Oh, I see. Ganito. Why don't you go home, pack your bags already? I'm pretty sure you will need all those. Rest in looking for another job.
Oh?
Didn't you hear me? Why don't you take the time and go and look for another job?
Huh? Bakit po?
You're fired! Alis!
Boss,
Doon!
pero pinagpahinga po kasi ako ng nurse.
I don't care. I've given you all the day to finish the project. Nagawa mo ba? Natapos mo ba?
Boss, kasi...
Fired! You're fired! Oh, ano ba yung kinakain mo? Kain ka ng kain. Alam mo naman borderline diabetes ka na, di ba? Ala, hindi mo ba alam na marami ka pang pwedeng gawin bukod dyan sa kain ka ng kain? Pwede kang maghanap ng trabaho. Mag-exercise ka naman. Diyos ko, wala ka na natutulog dito sa bahay. Alam mo naman buntis ako, di ba?
Kumain ka muna.
Ay, ba't ako natahimik? Tignan mo nga itsura mo, tumataba ka na, kaya ka na kayo ng mga matatamis. Di mo ba alam kondisyon mo, may diabetes ka na, di ba?
Kama mo na may
Ay!
Ikot pa ako eh.
Ay, huwag mo nakalikuran! Sinasabihan kita, ha?
Pwede ba? Pabayaan mo pa na ako. Relax ka muna dyan.
Ay,
Isip
paano
na
ako
ako
relax
paraan eh.
dito?
Nag-isip na ako paraan. Kakatanggal ko na sa trabaho ko, ano gusto mong gawin ko. Kasi naman may mga hanap ako agad na trabaho once na umalis ako ngayon.
Kaya nga, gumawa ka ng paraan para makahanap ka ng trabaho. Hindi yung kaya nun dito ng matatamis.
Eh wala pa nga akong magagawa ngayon. Mag-relax ka muna dyan. Diyos ko, hindi ka magpahinga muna dyan. Nag-iisip pa nga akong paraan eh.
Paano ako magpapahinga? Nag-aalala nga ako sa'yo. May sakit ka, diabetes, tapos kakain ka ng bawal.
Oo na nga eh! Diba? Gagawa na nga ng paraan eh. Tulong! Tulong! Paano ka? Uy! 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 Tulong! Tulungan niyo kami!
Sandoval. Ma'am? Si Sandoval? Hello po, ma'am. Kukuha lang po ako ng vital signs, ha? Tsaka yung dugo niyo po. So for the diagnostic test for gestational diabetes, one is the glucose challenge test, which is you have to have a glucose challenge test first. And another name for this blood test is the glucose screening test. In this test, a healthcare professional will draw blood 1 hour after you drink sweet liquid containing glucose. You don't need to fast for this test. Fasting means having nothing to eat or drink except water. The second diagnostic test is the oral glucose tolerance test, or the OGTT. It measures the blood glucose after you fast for at least 8 hours. First, a healthcare professional will draw your blood, and then you will drink the liquid containing glucose. You will need your blood drawn every hour for 2 to 3 hours for a doctor to diagnose gestational diabetes. Okay po. So ma'am, isisend ko po sa lab yung dugo nyo, tapos makakakuha tayo ng result in siguro po mga day after. So sa ngayon po, ma-admit po kayo dito, tapos darating din po si Doc once na nandyan na yung mga results. No ma'am?
Sige, Miss.
Okay, thank you ma'am. Magpahinga lang po kayo, okay?
Okay po.
Alright. Si Sandoval po. Good morning ma'am. Nandito na po yung lab results natin. Ako, ayon sa lab results natin, medyo mataas yung blood glucose mo. Ngayon, dahil buntis ka, ang tawag dito ay gestational diabetes.
Gestational diabetes occurs when your body cannot make the extra insulin needed during pregnancy. Insulin, a hormone made in your pancreas, helps your body use glucose for energy and helps control your blood glucose levels. So during pregnancy, your body makes special hormones and goes through other changes such as weight gain. Because of these changes, your body cells don't use insulin well, a condition called insulin resistance. All pregnant women have some insulin resistance during late pregnancy. So most pregnant women can produce enough insulin to overcome insulin resistance, but some cannot. So these women develop gestational diabetes. First, I want you to follow a healthy eating plan. So food choices, amounts, and timing are all important in keeping your blood glucose levels in your target range. So I want you to also be physically active. So physical activity can help you reach your target blood glucose levels. Being physically active will also help lower your chances of having type 2 diabetes in the future.
Sige na, magpahinga ka na dyan. Ako nang bahala dyan. Baka mapano ka na naman. Ako na dyan.
Pahinga na ako.
Kaya pupunta nito. Nanganak na si Sarah, wala pa rin pabiling gatas. Ay. Ano kayang gagawin ko nito? Ay, wala pa lang tubig. Pabili po.
Ano pong kailangan?
Ate, may isa ba kayo dyan?
Okay, ilan?
Ito lang. Oh, pwede mo na. Thank you.
Okay, thank you.
Hoy! Sira ulo ka! Hindi ka nga dito, tingnan mo nga itong sugat ko.
Anong meron dyan?
Eh, parang hindi ko magaling. Upo ka dito.
Ala! Hinana! Tapos, hindi pa gumagana. Ang hindi na din ang sugat mo.
Dalawang linggo na atang ganyan yan. Ano kaya yan? Pucha! Ang dami problema! Wala na akong trabaho, wala na akong magkakasugat pa akong ganyan.
Alam mo, patingin na natin agad yan kasi tignan mo hindi na gumagaling mo. Lumalala pa, minana pa.
Gastos na naman, wala na nga tayo pang-bayad sa
kaysa
nakakautan mga...
Kesa lumalaya, patingin mo na, mapatingin lang naman yan eh.
Paano tayo pag ano? Paano tayong pera?
Huwag mong isipin yan. Isipin mo yung sugat mo sa paa. Hindi na nga gumagaling. Huwag gusto mo bang lumalayan.
Oh, sige, natawag ng tricycle.
Good morning, Mr. Sandoval.
Good morning po, Doc.
Kumusta na? Ano nangyari sa atin?
Actually, Doc, nasugat po ako dito banda. And,
Gano'n na yan katagal?
almost 2 weeks na, Doc, pero hindi siya gumagaling.
Okay. Kasi, alam mo, risk factor yan sa mga diabetic. So, based sa aming findings at based dun sa diagnosis sa'yo before, sabi sa labs mo, borderline diabetic ka na pala. Gano'n na katagal?
Around a year or so po.
Okay. So, based sa aming findings and consistent ka dun sa lab reports ng doctors mo before, medyo mataas yung blood sugar mo. Now, karaniwan sa diabetes, meron tayong tinatawag na type 1, type 2, and gestational diabetes. So, sa type 2 diabetes, ito ay karaniwang nangyayari dahil yung mga cells natin sa muscles, taba o atay ay nagiging resistant sa insulin. Ang resulta, yung cells sa katawan natin don't take in enough sugar, and then the pancreas, they can make enough insulin to keep the blood sugar within the healthy range. Now, isa yun sa mga complications ng diabetic patients, yung hindi nag-heal agad yung sugat.
High blood sugar levels caused by diabetes can damage the nerves and blood vessels in your body. That includes the ones in your feet and legs. So if your nerves are damaged, you might not feel pain. So you might not also feel heat, cold, sharp objects, or other symptoms of ulcers or infections. So if you have neuropathy in your feet, you could walk around all day with a rock in your shoe and not know it. So that means you could get a bad cut and not notice it until it gets infected. Some of the symptoms of type 1 diabetes and type 2 diabetes are first, feeling more thirsty than usual, urinating often, losing weight without trying, presence of ketones in the urine. So ketones are a byproduct of the breakdown of muscle and fat that happens when there's not enough available insulin. So also feeling tired and weak, feeling irritable or having other mood changes, having blurry vision, having slow healing sores, and getting a lot of infections such as gum, skin, and vaginal infections. So there are two types of diabetes mellitus. So the first type is type 1 diabetes. It can start at any age, but it often starts during childhood or teen years. So type 2 diabetes, the more common type, can develop at any age.
Kumusta po? May order po tayo? Pakitake yung vital signs ni sir. Baka kasi kailangan natin i-add for application. Okay, sige po. Okay, sir. Just take your vital signs, okay? So, Mr. Sandoval, madalas ka bang nakakaramdam ng pag-ihi madalas? Ganon?
Actually po, opo, tapos nilalagab na nga rin po yung ihi ko eh. Tapos,
Okay.
yun po, lagi pa ako nauuhaw kanina.
Nag-monitor ka ba ng blood sugar?
Hindi po religious na eh.
Okay. How about kadalasang pagkagutom or pagkauhaw?
Ano po, Doc, feeling ko pag hindi po ako nakakain, nahihilo po ako, nanginginig yung katawan ko.
Mr. Sandoval, verify ko lang po yung pasyente. Ano pong first and last name po?
Mateo Sandoval po.
Okay, very good. Okay, sir, I'm just gonna get the vital signs, tsaka yung check ko po yung status ng mundo, no?
Diabetes impairs how the body processes or responds to insulin, a hormone that allows the cells to take and use glucose from the bloodstream for energy. This disruption to insulin makes it more difficult for the body to manage blood glucose levels. When blood glucose remains permanently high, it impairs the function of the white blood cells, or the white blood cells are central to the role of the immune system. When white blood cells are unable to function correctly, the body is thus able to fight bacteria and close wounds. Uncontrolled diabetes may also affect circulation, causing blood to move more slowly, which makes it more difficult for the body to deliver nutrients to wounds. As a result, the injuries heal slow and may not heal at all. For our nursing diagnosis, risk for unstable blood glucose level, we would assess for signs and symptoms of hypoglycemia, monitor and perform blood glucose check, administer diabetic medication, oral and insulin as prescribed, count carbohydrates for all meals and snacks, assess patient's level of understanding and knowledge of diabetes, educate patient on chronic condition of diabetes mellitus, educate patient on how to monitor blood glucose levels, educate patient on dietary restriction, carbohydrate counting, meal planning, and assess patient support system. So for our nursing intervention, our diagnosis will be risk for infection. We want to teach and promote good hand hygiene, maintain asepsis during IV insertion, administration of medication, and providing wound or site care. Rotate IV sites as indicated. Provide catheter or perineal care. Teach female patients to clean from front to back after elimination. Provide meticulous skin care by gently massaging bony areas, keeping skin dry, keep linens dry and wrinkle-free. Place in a semi-Fowler's position. Encourage cuffing or deep breathing if the patient is alert and cooperative. Frequent repositioning is also recommended. Provide tissues or trash bag in a convenient location for sputum and other secretions. Instruct patient in a proper handling of secretions. Encourage and assist with oral hygiene and administer antibiotics as indicated.
How are you naman po?
Hindi ko na alam, nurse. Nalulungkot na po ako.
Bakit naman po? Ano po? Why do you feel that way?
Siyempre, nurse, nawalan ako ng trabaho. Tapos, ito pa yung mangyayari. Napupunan mo na pa. Tapos, yung baby ko, di ko alam paano.
Kamusta na yung wound niya? Yan yung patient natin dyan sa ward, no? Si Mateo po, sa Hawaii. Grabe yung nangyari sa patient na yun, no? Nagsimula lang doon ng borderline diabetic, tapos yun. Hindi kasi nagpapacheck up lagi, tapos parang nanamba, wala ng trabaho. Ayun, sinabi mo, Dok, alam mo, sobrang ang sakit ng ano niya. Sinasabi ko nga na kung pwede siyang i-refer din sa therapy kasi he's thinking about yung ending ng life niya, gano'n. So, parang kailangan po natin i-follow up yun siguro after ng discharge niya. So, ngayon, yung sugat niya, it's healing a little bit better. So, I think he will be ready for discharge maybe in a few days. It's up to you kung kailan po.
There is a house built out of stone.
Yung gamot mo, tignan mo yun, nagagalaw.
On the floors, walls,
Hindi mo dinagagalaw. Ano bang, masakit ba? Masakit ba? Kailangan mo magpaano, uminom ng gamot to. Di ba sabi ni Doc, kailangan mo ituloy ang gamot mo, tapos i-monitor daw natin yung blood sugar mo. Ano ba nangyayari sa'yo, Mateo? Oo, ano? Nagagalaw. Ang taas ng ano mo, ng sugar mo. Ay, yan ang sinasabi ko sa'yo, Mateo. Kailangan mo talaga uminom ng gamot mo, tsaka nagmo-monitor ka dapat ng blood sugar mo. Para na may maintain mo, na balance yung ano mo, sugar mo sa katawan.
Tingnan ko.
Huwag mo na sabihin yan! Ano ka makamatay? Huwag mo sabihin yan, hindi ka mamamatay.
Gulong-gulo ang puso. Saan ba to patungo? Di ko alam. Di ko alam. Hinarap lahat na balakid. Pero bakit walang kapit? Ang mga pangakong binitawan. Di ko alam. Di ko alam. Hindi kita malilimutan.
Mateo, ano ba yung gamot mo?
Hindi kita
Mateo! Ba't mo ginawa to? Mateo!
nakaukit
Bakit ka
mapakailanman
nagpakamatay?
sa aking pala ang iyong pangalan.